and the advice that has been coming from the scientists. And
we have been guided in our approach at airports, as elsewhere, by scientific and medical opinion.
We've been very clear that we follow the science.
I won't say it again because you will probably interrupt me.
But that decision, of course, will be made entirely on the advice of science.
Well, I think we did have a generic plan.
Would soon not care about human values, but only about efficiency. Politicians, they said, would soon not listen to citizens, but only to scientists and engineers. If only...
Grab a cup of tea and maybe a few biscuits for this one. It'll take a while to explain, but I hope you'll agree that it's worth it. However, to really understand the background, the importance of scientific integrity and freedom from political process, we'll need a little history. We've known ever since the Condemn coalition government came to power in 2010 that people on benefits, on pensions, people who were sick or disabled, and basically anyone who didn't contribute to the financial wealth of rich conservative donors was going to have a hard time. Condemn austerity slashed the finances of health and social care organisations, issued wage freezes for their staff wherever they could, and doubled down on means testing and medical review for those in need of state aid to live. We've all seen the awful stories of suicides and starvation caused by DWP austerity against a backdrop of tax breaks for the wealthy and tax avoidance schemes for large companies, whilst our politicians, many of them cabinet ministers, hid their own wealth offshore to avoid paying the taxes that would help fund those very services. Conservative policy has robbed waspy women of their pension rights, reduced the real-time earnings of public sector workers in the NHS and social care, as well as slashed the workforce numbers in these and many other vital services, including police, fire and housing. The Tories are no friends of the poor, or of those who protect and care for them. The sick and the elderly have been singled out for particular attack, not only by removing the services and benefits that they rely upon.
We hear an awful lot of lefty whinging about the NHS waiting lists. Well, the answer's simple. Shut down the health service. Result, no more waiting lists. You see, in the good old days, you were poor, you got ill, and you died. and yet these days people seem to think they have some God-given right to be cured. And what is the result of this sloppy socialist thinking? More poor people.
By ensuring that people have to work longer to qualify for their retirement pensions, and the DWP health checks ignore medical advice, the government often makes it close to impossible for severely disabled citizens to jump through the hoops set for them. That's the backdrop. The Conservatives have no regard for the welfare of anyone not financially independent. If you're not working, you're not rich, you're not important. Even if you are working, the Tories have been extremely rigorous at reducing your rights as well as your access to healthcare should you need it. Tribunals for unfair dismissal are much harder to access, and legal aid is all but unattainable for the vast majority of citizens. So before we go any further, please bear this single point in mind. The government doesn't care about people from whom it cannot profit. You know, the elderly, the disabled, the unemployed, the sick, and those in care homes. These are groups of people we refer to again, so keep them in mind. Now a little science history, just so we're clear about the relationship between politics and scientific discovery.
Never before have there been so many issues that required so much scientific input to solve. Issues involving energy, the environment, infectious diseases, pollution, global warming, and so forth. But never before has the required scientific input been so sabotaged, misused, or ignored.
Remember those groups I mentioned earlier, the elderly, the disabled, the unemployed, the sick, and those in care homes. We've heard a lot about these groups recently. They're the ones most at risk from Covid-19. They're also the ones with the least protection from government, both historically, as we've already seen, and currently, in the midst of the Covid-19 pandemic. It's interesting that they're the same people the eugenicists targeted. They believed that what is natural must be right, and that since nature lets the weak die, then human society must do the same. A group that would certainly include a number of modern MPs, not least the current Prime Minister, whose string of unacknowledged children, whose penchant for lying and adulterous behaviour in general would certainly have earned him the title moral defective back in the day.
Now, what are you asking here? It's perfectly true that I have had some drugs. Have you?
But of course his wealth would have protected him anyway, just as it does today. Boris isn't the target. He's the intended beneficiary, along with all the rest of his kind, parasitically profiting from the work done by those who will never be paid what they're worth by this Tory government. That's one thing this pandemic has made very clear to us all, which are the people society can't do without. And they don't tend to be the richest. They're all tucked up in splendid isolation. It's the poorest who have to take all the risks. The nurses, the care assistants and support workers, the supermarket staff, the delivery drivers and the food producers.
I found out a colleague has tested positive, and one of our staff members is in intensive care.
The video diary of one care home manager that speaks for so many.
Incredibly tough at the moment.
Britain's frail and elderly, and the often low-paid workers who care for them, in the words of a group of leading charities today, abandoned to the appalling devastation of coronavirus.
We've all known forever that they're the real wealth creators, but now we know just how unimportant their employers, the wealth takers, really are. And we know something else. We know that this government is doing everything it can to give the appearance of concern, whilst simultaneously undermining the chances of those that Hermann Goering described as useless eaters. You know, the elderly, the disabled, the sick, and those in care homes.
It is clear now that care homes and their vulnerable residents have paid a heavy price in this crisis.
Okay.
Deaths quadrupled in 1 week.
At every daily briefing, the government tells us that they're being guided by the science, but what exactly does that mean? SAGE stands for the Scientific Advisory Group for Emergencies. It's been around for a long time, but only under this government has it become secret. We used to know who sat on it. Now we don't. Under previous regimes, the Prime Minister always chaired SAGE meetings, but not our own dear leader. He's missed no fewer than 5 such meetings, citing personal issues, not illness. This isn't about his recent hospitalisation or recuperation. In his place, he seems to have sent Chief Advisor and unelected spin doctor Dominic Cummings instead. Cummings isn't a scientist. We learned last February just sort of man he is when The Guardian reported his blog on designer babies, as a view that geneticists described as unethical, unworkable, and most importantly of all for our purposes, eugenicist. Cummings was also the man who paved the way for Eugenicist Andrew Sabisky to get a job at number 10, an appointment that proved short-lived when his disgraceful opinions came to light and he was forced to resign. Neither Cummings nor Prime Minister Boris Johnson have commented. Cummings wrote in his blog on designer babies, It goes without saying that turning this idea into a political government success requires focus on A, the NHS, health, science, not getting sidetracked into B, arguments over things like IQ and social mobility. Over time, the educated classes will continue to be dragged to more realistic views on B. But this will be a complex process entangled with many hysterical episodes. A requires ruthless focus. So a eugenicist who wants to rid the gene pool of defectives by ruthlessly concentrating upon the NHS, health and science is sitting on the SAGE advisory group?
His response again raises concerns about mixed messaging from the government and precisely what scientific advice they're relying on. Following revelations that the Prime Minister's chief political advisor, Dominic Cummings, is attending meetings of the government's scientific advisory group, SAGE, Channel 4 News has heard concerns that it's unbalanced, with public health experts who manage infectious disease outbreaks day to day far outnumbered by mathematical modelers. And a local public health official we've spoken to said that critical resources, support and data is not being shared by the Department of Health.
Professor Richard Ashcroft of City University called Cummings' views cargo cult science. It's based upon a complete misunderstanding of reality, and so it seems is Cummings' science. Professor Ashcroft said, "This idea that we can use biological selection to improve individuals and society, and that the state through the NHS should facilitate this, really is pure eugenics." Remember those groups I mentioned earlier? The elderly, the disabled, the unemployed, the sick and those in care homes. Now think about government policy, the history of 10 years of targeted austerity and the vulnerability of those groups in particular. When the rest of the world was buying up PPE and ventilators, we were told it might be better to go for herd immunity and just take it on the chin, as Boris said. Of course, it's true that herd immunity will be necessary before we can say Covid-19 isn't a problem. But to get it without the use of a vaccine, well, let's just look at what that means. The reality is that around 70% of the surviving community have had the disease and developed antibodies. Are you frightened yet?
Like so many other homes, Warburys is battling dire staff and equipment shortages. But even more worrying, the home's owner has told Sky News he's been asked to take in patients from hospitals who are actively suffering from Covid-19.
I know that absolutely everybody said no, and there would be a very good reason for that. That would be tantamount to importing death into care homes. The care homes have done all the right things against all the odds. To add insult to injury by asking us to take COVID-19 positive patients is asking us to basically make out the suicide note for people in care.
4 residents here are still isolating in their rooms with symptoms, but only one has been given a test. It is hard to be the manager when you don't know what you're dealing with.
What is it that's upsetting you?
Because we've got a duty of care to these residents, and I just feel like this virus is just wiping people out, and it's really, really hard to watch.
Do you feel like you're getting any support?
From the company, yes, but from the government and public health, no.
I think there are different things, but I think, Eamon, we have to acknowledge that anybody who's in a care home is going to be in a very high-risk group. Nobody is in a care home unless they have several health conditions, and people are extremely frail normally when they're in care homes. So, tragically, if you do find yourself with this virus in a care home, there is going to be significantly...
The word surviving is important here. If we do just take it on the chin, we are very likely to lose large numbers of elderly, infirm, disabled, and those who live in cramped circumstances. You know, like the unemployed, those on benefits or low wage who can't afford anything bigger.
The poorer the borough, like here in Hackney and East London, the higher the death rate from this virus. The Office for National Statistics figures today show that the mortality rates in the most deprived areas of England and Wales are more than double those in the most affluent parts of society.
I said at the beginning, it was utterly predictable that it would follow the social gradient because everything else does. Why? Well, it may be something about being of lower social economic position that makes you more susceptible to whatever is going. And in addition, we know that comorbidity, having other medical conditions, hypertension, chronic obstructive pulmonary disease, diabetes, puts you at higher risk of fatality. And those conditions show a very clear social gradient. The poorer you are, the greater their frequency.
In the good old days, you were poor, you got ill, and you died.
That would be no great loss to the likes of Cummings, as they're the ones he wants out of the gene pool to begin with. Perhaps that's why Michael Gove, months into the crisis, was still suggesting that the UK run the virus hot, meaning merely to allow it to run its course. That old herd immunity gambit. Perhaps that's why, despite claiming to be guided by the science from Mr. Cummings and the Sage Group, we waited so long before entering lockdown, despite the advice of the science from Italy, from China, and from the World Health Organization itself.
In stage 1, we say nothing is going to happen.
Stage 2, we say something may be going to happen, but we should do nothing about it.
In stage 3, we say that maybe we should do something about it, but there's nothing we can do.
Stage 4, we say maybe there was something we could have done, but it's too late now.
But hang on, I hear you cry. We've built new hospitals, ordered tests, and bought loads of PPE. We've recruited loads of retired medical and nursing staff, and even Burberry and Dyson are making kit for healthcare professionals to use. Yes, that's all true.
Doesn't it appall you that it's not being used?
Oh, no. A very good thing in some ways. Prolongs its life, cuts down running costs.
But there are no patients.
No, but the essential work of the hospital still has to go on.
Aren't patients the essential work of the hospital?
Running an organisation of 500 people is a big job, Minister.
But if they weren't here, they wouldn't be here.
What?
No, Mrs. Rogers, it won't.
But we've also seen government guidance to increase the use of do not resuscitate orders, to discharge elderly people back to care homes without testing, even if we think they have Covid-19, to ramp up DNR orders on otherwise healthy disabled people, and the government has ignored care home death figures until forced to acknowledge them by the press. We still haven't managed to get into gear for this pandemic, even though the government's own 2016 exercise, Operation Cygnus, clearly demonstrated how unprepared we were and recommended all the things we're now doing half-heartedly and far too late. Burberry may well be making hospital gowns, but many smaller firms, not owned by Tory party donors, are offering help and being ignored by the government, even though they have stocks already in their warehouses, which they're now forced to sell to other countries just to stay afloat. We have a ward care ceiling policy, which is used as a matter of course to deny elderly people access to ICU, despite the fact that we have new Nightingale hospitals still unused that could accommodate them. It seems that there are plenty of resources, as Tory MPs all across UK have been instructed to tell us, but only if you're not in one of those groups I mentioned earlier. You know, the elderly, the disabled, the unemployed, the sick, and those in care homes. The people who cost the government money in benefits, in pensions, in care, and in health.
He was talking about one particular care manager who said in order to get his carers tested,
They needed to do a 5-hour round trip.
So you're right that we've now started testing care work.
Much has been said about the economy and how difficult it will be to recover from this, but that's hardly the point. Proper taxation of the wealthy, those we now know are far from vital to our country's welfare, and a proper scrutiny of offshore accounts would go a long way to sorting out that problem. But so it seems, would culling the elderly, the disabled, the unemployed, the sick, and those in care homes. And that culling wouldn't need to hurt the pockets of those wealthy Tory donors. If only the government had a eugenicist pulling the strings.